Hi, my name is Nick Vasquez. I'm an ER physician for TEC, but I've also served as the chair of the Vitalist Health Foundation for the last 2 years here in Phoenix. Vitalist is an organization that focuses a lot on the social determinants of health. I hope I can add some perspective and some value as we're all facing a sea change in our documentation coming up on 2023. So first things first, though, what are social determinants of health? Plainly put, they are anything that affects someone's health that has nothing to do with the direct provision of healthcare. Obviously, this is a very broad category, including education, economics, social factors, and where you live. For the purposes of this talk, we're going to limit our focus to only a few of these things, and that is housing, transportation, and access to care. Now, a good question is, why should we care? A lot of folks in EM will focus on the health issue that the patient has and try to ignore the outside factors they cannot control. However, there are now two good reasons to be aware of social determinants of health. The first is that it will directly impact your patient's health and the plan of care that you have. The second is starting in 2023, they will directly impact our documentation and our billing, especially if we don't document or ask about them. Next year, our billing will depend upon your medical decision-making that you can document. And there are three key factors in that: the number and complexity of problems addressed, the amount and or complexity of the data reviewed, and the risk of complications and or mortality. It is this last one that is most impacted by the social determinants of health. The more you can record the potential impact of these social determinants on the care plan, the more complex your MDM will appear. But let's not forget the first reason to pay attention to the social determinants is that the health of our patients are impacted by these factors greatly. So what factors should we be focusing on then? Because there's a lot of social determinants. So for emergency medicine, I think the three that we need to keep in top of mind are housing, transportation, and access to care. First up here, we have housing. I think this top quote sums it up best. When you're homeless, you're not thinking about your medication, but you're thinking about food, shelter, or heat for the night. They don't really have time or resources to care about their plan of care that you might have for them. The other thing is, regardless of the condition, being homeless will increase a patient's morbidity and mortality for almost all conditions. Recently in September, JAMA published research demonstrating increased mortality for cancer patients due to housing instability alone. Simply asking in your social history, where are you staying tonight or where are you staying these days, can identify patients at risk. Fun fact, fastest growing population of homeless folks in Maricopa County are over the age of 80. Second issue is transportation. A lack of transportation can be a real problem in Arizona, especially in rural communities. One study in 2005 demonstrated about 3.6 million Americans missed or delayed medical care due to transportation issues, and by 2017, that went up to 5.8 million. Lack of transportation can mean missed appointments, being unable to pick up medications, or having to spend unplanned money on transportation. Those most affected are the poor, chronically ill, and the elderly. Simply asking a question, how will you get to your appointment, or how will you get to the pharmacy, can identify those at risk. Last is access to care. This can be things like insurance coverage, financial resources, lack of a healthcare provider locally, stigma or bias you perceived in the medical community, work-related barriers like sick leave policies, or language. That's a big one. Why it matters is obvious. If a patient cannot get access to care, they cannot follow up with another provider that cannot get treatment. One example I had from my own practice was a young patient with a new onset diagnosis of glaucoma who could not afford transportation up to the ophthalmologist, couldn't afford the appointment, and didn't have insurance. She couldn't afford the meds. They were at a much greater risk for bad outcomes. So simply asking, do you have adequate insurance, can help identify patients at risk. To sum up, the social determinants of health are a broad category of things not related to the direct provision of healthcare, but that have a direct impact upon the health of our patients. Key factors for emergency medicine are housing, transportation, and access to care. In our medical decision-making, we need to demonstrate how our plan of care is impacted by these factors if they are present in our patients. We can do this in 3 simple steps. All we need to do is ask. The best practice is to make this part of your social history and ask about housing or transportation or access to care. Second, we need to consider, how might these factors impact the care of plan that I have for this patient? And then lastly, we need to document how those factors impact our plan of care and make sure that the MDM is given credit for the complexity of care. Thank you very much, and I hope you've enjoyed this. I hope it was helpful.